Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
We do have a little bit of a reprieve. We don't know how long the reprieve is going to be. CMS has not yet said how long they're going to delay ICD-10, but we don't need to delay our preparation for it. So I'm going to give you some examples in pediatrics specifically. Then we're going to talk about some challenges in evaluation and management coding. Here's our issue. In pediatrics, we're dealing with children. Some of them may have chronic illnesses, but generally we're not dealing with the same sorts of patients that the Medicare documentation guidelines or the CMS documentation guidelines seem to have been written for. So we've got some challenges. How do we make what we do fit into those documentation guidelines that CMS has given us? I also want to talk about some EMR issues because everyone, just about, is going to an EMR, and there's some specific issues that I'm coming across, and I am involved in a national audit on some EMR issues. So I'd like to share those with you today. Then I want to briefly go through some pediatric office procedures because I find that this is where offices often lose money because they don't code these appropriately. Sometimes they don't bill them at all. They'll be doing the procedures and just bill an office visit. So I want to go through some of those, and again, it'll be pretty quickly. And then we want to finish up by talking about preventive medicine coding issues. Now, preventive medicine, pediatrics has always done preventive medicine. We've always done those well child checks. But there are some new coverages, some effects of healthcare reform or the Patient Affordable Care Act that are going to affect pediatrics. Okay, talking about preparing the physicians for ICD-10. The thing is we have to have them understand ICD-9 first. A lot of them do not appreciate the importance of ICD-9 codes, but you might want to look into this aspect. Many payers are looking at paying based on diagnosis code, based on severity of illness, and not just on your CPT code or your evaluation management code. So we really need to work with the physicians on having them document more specifically. And especially as we go into ICD-10, we want to look at some of their documentation and see, okay, this is how we coded it in ICD-9. Will we be able to code it in ICD-10? Is there more specific information that the physician needs to document? And we can begin to work with them on that. In some cases, they're slow learners as we go into this. So the fact that we may have a little bit more than a year and a half to get ready shouldn't make us sit back and not get ready. It gives us a little more time to work with them on that. And then you want to look at some of those documentation improvement strategies. If they need to say more specifically about otitis media, for example, we want them to start saying that. And that's on the next slide. One of the things that's frustrating with physicians is 382.9 is not the only otitis media diagnosis code. In ICD-10, we will now be specifying laterality. So we'll need to know left ear, right ear, or bilateral. And as the mom of a child, I can tell you it does make a difference whether that ear infection is in both ears or just one. Sometimes it makes all the difference in the world as to how hard they cry and how hard it is to deal with. So it is important to know whether it's bilateral, whether it's one ear or both. We're also going to have an additional code for perforated tympanic membrane. Now, in ICD-9, this is something that you may not have noticed or you may not have coded correctly, actually. But in ICD-9, if a patient has otitis media and they have a perforated TM as well, you do not code the perforation. It's considered part of the otitis media. However, in ICD-10, you will code it separately. Also in ICD-10 are several codes, as noted on slide number 4, for exposure to tobacco smoke, whether it's environmental smoke, whether it's a
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.